So, welcome back, everybody, to these vitality and balance talks with veterinary and human leaders in science, where we're going to talk about things like susceptibility and resistance to disease. And today it's my honor and pleasure to have with us a friend and colleague, actually someone who taught me back in vet school in the 70s or 80s, Dr. Gene Dodds, who's been a practicing veterinarian for, gosh, 50 years?
56.
Yeah. Wow, over 50, wow. So she was a veterinarian back when there were very few female veterinarians, so thank you for that, Dr. Dodds. And since then, she's been focused on a research-oriented way to keep animals not only surviving, but thriving and having healthy and long lives. On her journey, she's become a pioneer in thyroid research and sensitivities and allergies and immunology. And we could spend an hour talking about her hundreds of published articles and research and popular books about the canine thyroid epidemic and nutrigenomics, which is the effect that the environment and what you eat has on your genes. But I do want to focus on her most recent accomplishment a couple of years ago of a new test called the cell bio test that uses saliva to check for the internal balance of pets, which actually can increase their chance of getting a disease later in life, and actually is a direct marker for disease. So with that long-winded intro, welcome Dr. Dodds. Thank you so much for being with us.
I'm very pleased to be here, Jeff, and happy to speak with your group anytime.
Thanks again. And why don't we just go right from cell bio to how do you think of terms like vitality and balance, starting with, I guess, what is vitality in your mind?
Well, vitality comes from vita, which means life. Vitality to me is everything. It's animation, it's spirituality, it's thriving, it's the will to live, it's the enjoyment of life. They are so many things, but the critical part about vitality is it has to be balanced in life. You can have people that are so exuberant that they're not even aware of potential risks in their environment or what they're doing. So vitality is what we always strive for and will help us thrive and live a long life with quality of life, but it needs to be balanced. And balance means equilibrium, right? An equal part of good things and then keeping the bad things under control, but recognizing that life has good and bad. It always does.
Now, do you think, going back to vitality, because you did this great, broad sweeping definition of vitality, do you think it has any scientific place in science? Do you see any correlation between vitality and, say, cellular energy?
Well, sure it does. There's a lot of science associated with the vitality of cells and how they live and what they do. I mean, we're looking at it now at the nanoparticle, the little tiny particles we can't see. We're looking at it at the cellular level. The mitochondrion, for example, which is part of the cell, is all part of the regulatory machinery that keeps cells alive and vital. So yes, of course, there's science behind it. But we see it when we look at people, when we see the shining in their eyes and see the happiness on their face, and we see the joy that they give to others by being here with the rest of the sentient beings on our planet and the things that aren't sentient, even the plants, for example.
Beautiful, thank you.
They're living too, right?
They are. So do they have vitality?
Well, I think
if we're calling vitality energy,
deal with functional anatomy and functional phytotherapy and everything believe they have vitality. And we've had excellent talks at our Holistic Veterinary Medical Association annual meetings about the value of plants and how they talk to us and what they mean. Sure they do.
Okay, great. So now talking not about plants, but more about bacteria or viruses or other germs. Do you think that the germ is more or as or less important than the internal balance that we're just talking about?
I think the internal balance is the key. Microbes are in much larger supply in the world, that we live in and the other animals live in. There are many more of them, but they're made to be there, to be in balance. So that the body has that microbiome, we call it, needs to be balanced between the good and the bad, and the germs are part of that. I mean, maybe the average person doesn't think about the fact that what's in their gastrointestinal tract and what leaves their gastrointestinal tract is full of all kinds of things that grow and are very active, and some of them are very bad. I mean, look at E. coli, look at salmonella, look at listeria, for example, and the question about whether the foods that we eat are contaminated with these substances today, and whether the food production industry, the meat particularly, and fish farming industries, are they really, really safe for us? And what about raw diets versus organic diet? Look at, if we don't eat organic foods, we're going to have glyphosate, Roundup contamination on everything. So we have the fertilizers and the pesticides and the herbicides, all of which imbalance the germs within our bodies and our animals' bodies.
And I guess that that goes into my next question about, do you have any feelings about why one pet gets sick from a bug or otherwise one pet gets sick and another doesn't? I'll give you an example. Two related healthy dogs go in the kennel, one of them gets kennel cough, one of them doesn't.
Right.
They were both.
Well, the only thing that we're similar to is if we had an identical twin. And in inbred, line-bred families of animals that are produced for a particular purpose or conformation or physical appearance, they're more alike genetically. And so in a litter of inbred puppies, for example, you might have 2 or 3 animals in a litter of 7 or 9 that are susceptible to something, and the others are resistant. Why is that? First, you have genetic susceptibility. They're born with that. Then you have immune system balance and resistance, and that's innate, what they're born with, and adaptive, what they adapt to as they continue to live and experience that. And then we have pollution, right? We have all of those issues, and you have the susceptibility of a particular animal to have a strong immune system, not overly strong, to combat these organisms versus a weak one. And it can be, except for an identical twin, you can be different. Everyone is an individual, and we're different.
So we're all like snowflakes. We're all different. We're all individuals.
Yes. Thank God.
Yeah.
How
And
boring we'd like to
isn't
be,
it
we're
all
all the
about
same.
individuality is the key
Yes, absolutely.
to a lot of things, including vitality and balance.
And females are less susceptible than males, and we've known that forever, because as life has evolved, the female is the individual that carries the young that has to be nurtured and protect them, whereas the male is different from that. And we know that there are many viral diseases, for example, that are much less common in females than in males. It's just a chance. Now, that doesn't mean that there isn't the opposite. There's some that females are more susceptible that males aren't. But generally, the immune system and protection is stronger in women than it is in men.
And
Sorry.
I have my own theories actually about why that might be, but do you see that in pets?
Yes, definitely. Mm-hmm.
Wow.
And of course, then the question becomes, is it the same in the pets, whether they're intact or neutered, right? And so there's a big argument and debate about, is it different once the female is spayed or the male is neutered? Okay, and if so, does it matter when they're spayed or neutered? And we know that in the female, if you spay them too young, they become urinary incontinent, nearly all of them later in life. below 12 weeks. For example, the early spay and neuter in pounds and shelters where they're trying to prevent the overpopulation. So they don't have any choice. They're trying to prevent this massive overpopulation. And so they're neutering and spaying animals much younger. And if you neuter a male between 8 and 12 weeks, it doesn't seem to change their susceptibility to prostate hyperplasia or whatever later on in life. But if you spay the female before 12 weeks, there's good data to show they're more likely going to have smooth muscle cell incontinence, in this case urinary incontinence, and leaking urine. So there is some difference there that we've wrestled with, but we still don't know what to do. And the age that we want to neuter males and spay females has changed recently. I'm sure you've seen that. We want to do it later than we used to.
Yeah, and isn't there a correlation between all kinds of different cancers and spaying and neutering too
There
early?
seems to be, yes, there can be. Yes, absolutely.
Yeah, so I guess again, all goes back to balance, and that if they're spayed or neutered too early or at all, then that may contribute to the imbalance. Do you have any tips for helping to promote balance
You mean generally?
in
Well,
pets?
the most important thing is going to be the diet, without any question, and not exposing yourself to all these preventives for heartworm and fleas and ticks that have been shown not to be safe versus those that are safe, using more natural, we call that natural in quotes, options if necessary. The critical thing is keeping the nutrition balance. You have to have the microbiome properly balanced between the good bacteria and the bacteria that can produce harm, because you need both of them in a balance. And the problem is that the most important part of it, I think, is the gut-brain axis. We now know more and more about the microbial organisms that live in our bowel that affect our brain, our cognition, our behavior. And that's so important now, especially with aging pets and aging people. You need to make sure that you've got the right diet to keep your brain in good balance. Very, very important.
Okay, so when you say the right diet, does that mean you have to choose the right dry food, or that we should be feeding fresh food or
Well,
raw
obvious. The best food is going to be unprocessed. It's going to be
processed?
fresh, human grade, and raw. The problem is that many people don't know how to make that diet and balance it properly. And there's all this misinformation on the internet about the risk for raw diets, when in fact, kibble diets aren't sterile. No food is sterile. So the raw diet is obviously better if we can do that, but it can be freeze-dried, dehydrated, subjected to high pressure pasteurization. So there are ways to make sure that it's safe today. And that would be a better diet. But interestingly enough, what came up recently, just in the last 6 months, what about fecal transplants? What about microbiome restorative therapy, which sounds much better than fecal transplants? Anyway, in people and animals, they now know there's certain criteria. In fact, frozen microbiome therapy is being managed today in humans in blood banks, because it's a live product that you're giving to restore the balance of the body, just like you would if you were giving a blood transfusion. Now, the critical thing is there have to be the right criteria for the donor. So you select a donor who is healthy, and then the question is, they can't have any drugs, they can't have any diseases, they can't be taking any kinds of supplements that could be present in the transplant material. But what about the fact that if you're transplanting healthy donor feces to a patient that has a food sensitivity, like a child with a peanut allergy, obviously the donor shouldn't have eaten peanuts recently, right? People say, oh, it doesn't matter. Well, it does. They just had the first documented, proven case in a transfusion of a boy with lymphatic leukemia that was given a whole blood transfusion one day and the next day needed another transfusion. The patient had a significant peanut allergy. The first transfusion had no problem. He nearly died after the second one. They saved him, thank God. Turned out that the first person had never eaten peanuts or peanut butter. The second person, the morning he donated, he ate peanuts. And they showed on the molecular electrophoresis of the plasma of the child and the donor, the peanut.
Mm.
So the first time, this has been suspected, this is actually proven molecularly now. They found the reaction in the child to the peanut, exactly the peanuts that the donor ate that morning. Isn't that interesting?
Huh. So it seems like everything that we do or touch or eat, it's all gonna have an effect in some ways. So I guess
Yeah,
that,
recognized, absolutely. So that means that if we get a microbiome transplant, a fecal transplant in a pet, we have to be sure that the donor doesn't eat any food that that recipient could be known to be intolerant of.
got it. Yeah,
Isn't that amazing? I mean, it's intuitively obvious now that
it
we
is.
know
Yeah,
it.
yeah. So we've
Hmm.
talked about a lot of different manifestations of, health challenges, health problems, diseases, symptoms. Do you see any connection between the symptoms that the body shows and, cellular energy or energy in the body in general?
Absolutely. I think we get the symptoms of lethargy. We get the symptoms of apathy, not really caring about anything. We get gastrointestinal symptoms that can be intermediate. They can just be gas formation. It doesn't have to be It's not usually vomiting, by the way. It doesn't have to be diarrhea or constipation, but often can be just gas. You can hear the pet's tummy, when they're lying down and you're watching TV with them at night, for example. You can have scratching and itching, hot spots, chewing the feet, running up to an indoor-outdoor rug and scratching the face on the rug, or on any other kind of thing that can relieve the itching. It's intense itching. That's probably one of the most often seen clinical signs of an imbalance in the body.
Isn't it
Do you
so
agree?
yeah, for sure. And actually, I'm happy. And I just said this to somebody today with an itchy pet. I'm happy that your pet is itchy and that its liver isn't inflamed. So, I think that itch is maybe a quality of life issue for some pets, but I'd rather see a patient with an itch or an ear problem or an external problem than a deep internal imbalance.
Absolutely. Absolutely.
But so you just gave a couple of great examples. Is there any way that that information is clinically helpful for you? Does it help you
Yes, of
make
course
it?
it helps. We balance things, sure.
In what
We
way?
strive to balance the probiotics, the prebiotics, all of the appropriate nutrition. Prebiotics and probiotics are essential. They're particularly important for German Shepherd dog breeds and the related breeds. The prebiotic FOS, fructose, oligosaccharide,
Oligosaccharides. Yeah.
and then the other one, mannan, MANNAN oligosaccharides. Both FOS and MOS are very important for stabilizing the gastrointestinal tract of certain breeds of dogs. They're critical, in fact.
Now, what about all the other things? What about life things like, having a good life outside of probiotics or food or things that we take
Sure.
in our mouth?
Sure. We do enzymes, you do supplements, you do whatever. We don't want to over supplement. We see too many patients that have bought into this concept correctly, but then they come with a shopping bag full of things. And what they don't realize is that many of these things work at cross purposes because they have the same ingredients in them. And so they're imbalanced. In other words, they're not giving enough zinc, or they're giving too much vitamin D, or they're not giving enough vitamin E or vitamin C, and things are all out of balance. So we have to tell people you have to be really careful when you keep adding another supplement and another supplement to balance. And you need somebody like yourself or the people that I work with that can determine what the appropriate balance is. And they
Got it.
don't teach that in veterinary school.
And yeah, Yep, balance is not, yep. And that kind of brings us back to the overall theme, because we talked about the microbiome and diet and, well, supplements and things that you can do, but whatever you do, it's all got to be balanced, is
Right.
basically
And
what
you
I've
have
heard
to
you
have
say.
rest and you have to have exercise.
Rest, exercise.
Right.
Great.
Okay.
I really, 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 really appreciate your time, Dr. Dodds, and we will talk again soon. And thank you so much for coming.
Thank you, Jeff.